Hi, I'm Congresswoman Schakowsky.
And I'm Congresswoman Doris Matsui, and we're the co-chairs of the House Democratic Caucus Seniors Task Force.
50 years ago, on July 30th, 1965, President Lyndon Johnson signed Medicare and Medicaid into law.
Today, it's hard to imagine America without them. But before Medicare and Medicaid, nearly half of all seniors had no health insurance. Many pregnant women and children were uninsured. If you were disabled, it was hard to find private insurance. And if you needed long-term care, you were on your own or dependent on your families.
Today, more than 1 in 3 Americans are covered by Medicare and Medicaid. Medicare provides guaranteed health care for 55 million people, including more than 46 million seniors and 9 million non-elderly people with disabilities. A majority of people receiving Medicare are women. We're among them. We both proudly contribute to Medicare and carry our Medicare cards.
Nearly 70 million children, adults, and seniors are covered by Medicaid. Medicaid gives kids a healthy start in life and covers 1 in 3 children and 45% of all births. It is the single largest payer of mental health services, and it pays for 40% of the nation's long-term care costs, home and community-based long-term care services, and nursing homes.
Medicare and Medicaid have been part of American life for half a century. Over the last 50 years, we've made changes, improving quality, adding benefits, and expanding eligibility. And we can do more to make them even better.
4 million adults, half of them women, live in states that haven't opted to expand Medicaid through the Affordable Care Act, even though the federal government is paying for it. Getting those states to act is a top priority.
Half of all people on Medicare live on less than $23,500 a year, and we believe we need to make it more affordable, such as lowering costs by having Medicare negotiate for drug discounts. And we should work to cover additional services that seniors need, like hearing aids, vision, and dental care.
We can make Medicare and Medicaid better, but we must never erode their protections. That's why we so strongly oppose Republican proposals to cut benefits, shift more costs onto the backs of older Americans and families, raise the age of eligibility, or take away access.
The Republican budget resolution passed this year would turn Medicare into a voucher program and put insurance companies in charge. It would eliminate Medicaid expansion, taking away health care from over 16 million individuals, and includes additional Medicaid cuts of $500 billion.
Those are cuts seniors and American families simply cannot afford. Instead, we need to make Medicare and Medicaid even better for this and for future generations.
So, as we take the time to celebrate this important 50th anniversary, we also pledge to you that we and the Democratic Caucus Seniors Task Force will continue to fight for high-quality, more affordable health and long-term care for you and your family.
Happy 50th anniversary, Medicare and Medicaid.